In 1932, the United States government began a medical study. It was supposed to last 6 months. It lasted 40 years. The study took place in Macon County, Alabama. It involved 600 black men, most of them poor, most of them sharecroppers, many of them illiterate. They were told they were receiving free medical care. They were not. At the time, syphilis was widespread and dangerous. Left untreated, it could cause blindness, paralysis, mental deterioration, organ failure, and death. There was no reliable cure in the early 1930s. Doctors wanted to understand what happened when the disease was left untreated, so they decided to watch it happen. The men were divided into 2 groups. About 400 had syphilis, 200 did not. None of the infected men were told they had syphilis. Instead, doctors told them they were being treated for bad blood, a vague term commonly used at the time to describe many illnesses. They were promised free exams, free meals, and burial insurance. For men with little access to health care, this sounded like help, but there was no treatment. Blood tests were taken, spinal taps were performed, painful procedures were explained as special free treatment. The disease progressed, and the doctors kept watching. In the 1940s, everything changed. Penicillin was discovered. It was safe, it was effective, and cured syphilis. By 1947, penicillin was widely available and considered the standard treatment. But the men in Tuskegee were not given it. The study continued. Doctors actively prevented the men from receiving treatment elsewhere. Local physicians were instructed not to treat them. Draft boards were told to exempt them from military service, where they would have been treated. The goal was clear: let the disease run its course. The men trusted the doctors. They showed up year after year. They believed they were being helped. They believed the government would not harm them. They were wrong. As time passed, the consequences became impossible to ignore. Men went blind. Men lost their minds. Men became paralyzed. Wives were infected. Children were born with congenital syphilis. Deaths were recorded. And still, the study continued. By the late 1960s, some doctors began to object. One public health worker repeatedly raised concerns. He was ignored. So he leaked the story to the press. In 1972, the truth became public. Newspapers exposed the experiment. The public reacted with outrage. The study was finally stopped. By then, dozens of men had died directly from syphilis. Many more had died from complications. Families had been destroyed. And none of it had been necessary. A cure had existed for decades. The government settled lawsuits. Survivors and families were compensated. New rules were written. Ethics boards were created. Informed consent became law. But the damage went deeper than policy. The Tuskegee Syphilis Experiment shattered trust. It reinforced fear. It left generations of black Americans wary of the medical system. That distrust did not come from rumor. It came from history. In 1997, 65 years after the study began, the U.S. government formally apologized. The president acknowledged what had happened. He called it shameful. He said it should never happen again. The damage went deeper than policy. The Tuskegee Syphilis Experiment shattered trust. It reinforced fear. It left generations of black Americans wary of the medical system. That distrust did not come from rumor. It came from history. In 1997, 65 years after the study began, the U.S. government formally apologized. The president acknowledged what had happened. He called it shameful. He said it should never happen again.
But apologies cannot restore lost lives. They cannot undo suffering. They cannot erase the truth. The Tuskegee Syphilis Experiment was not an accident. It was not ignorance. It was a decision. A decision to observe rather than heal. To study rather than save. To value data over human life. It reminds us that science without ethics becomes cruelty, and that progress without consent becomes abuse. This wasn't ancient history. It ended in 1972, and its consequences are still with us. This is WTF History.